Welcome back to Nursing Research Tips, the podcast that makes research just a little less intimidating and a whole lot more useful for your everyday nursing practice. In today's episode, we're diving into two main ways that nurses approach research questions: quantitative and qualitative research. But before we get too far in today's episode, I want to let you know that I'll likely be using some terminology that you don't completely understand if you aren't super familiar with the world of research methodology. And that's okay. Today is about providing a brief introduction to this topic. We will get much more into the weeds for many of the topics I'll be briefly mentioning, including some further discussion of data collection methods, the meaning of some statistical terminology, and much more in future episodes. Now, you might be thinking, do I really need to know the difference? And the answer is yes, especially if you want to be a nurse who confidently uses evidence and maybe even gets involved in research projects yourself. Understanding the difference helps you make sense of study results. It helps you communicate clearly in practice settings and even helps you choose the right methods if you're part of a quality improvement project or a DNP initiative. Plus, knowing the why behind research approaches helps you ask better questions. And that's where the real progress begins. Let's start with quantitative research, the kind of research that relies on numbers, statistics, and measurable data. So think about things like charts, graphs, and p-values, which I'm going to have a whole episode dedicated to p-values coming up in the future. Quantitative research is rooted in a philosophical worldview called positivism, which basically means that researchers believe there is one objective truth out there, and if we measure and control carefully enough, we can find that one truth. Quantitative research asks questions like, how many patients fall during the night shift? Does giving pain medication within 30 minutes improve patient satisfaction scores? Or what is the average heart rate variability in patients after surgery? It's all about variables, things we can measure and compare. In a well-designed quantitative study, researchers try to control for bias. They try to eliminate external factors that can cloud their study's results. And they use tools like surveys, checklists, or even physiological monitoring to gather data. Let's take an example you've probably encountered: hourly rounding. A quantitative study might ask, does implementing hourly rounding reduce the number of patient falls in a medical surgical unit over a 3-month period? To answer that question, you could collect numerical data, maybe run a t-test or a regression analysis, which are just fancy statistical tests that we'll get into later, and make a statistical conclusion. So that conclusion would either be yes, the data suggests that hourly rounding helped, or no, the data did not support the rounding intervention. This kind of research is especially useful when you're trying to propose that something works or that it doesn't on a large scale. It's about reliability, replicability, and generalizability, 3 words that we will also talk about in a future podcast episode. But numbers don't always tell the whole story, right? That's where qualitative research comes in, and we're going to get into that next. So now let's talk about qualitative research, often the less familiar sibling of quantitative research, but just as valuable. While quantitative research is about the how much or how many, qualitative research asks, what does this mean? Qualitative research comes from a different philosophical tradition, constructivism or naturalism. This worldview assumes that reality is not objective and that it is not fixed, but instead it's shaped by people's experiences, backgrounds, and interactions. In other words, the meaning behind things is constructed, not discovered. Qualitative research is perfect when you're exploring topics that are difficult to measure with numbers. Some questions that qualitative research might seek to address include, How do ICU nurses experience moral distress during end of life care? What is the lived experience of patients adjusting to a new diagnosis of diabetes? Or how do new graduate nurses make sense of their transition from student to nurse in clinical practice? Instead of surveys or analysis of numerical clinical data, qualitative research uses tools like interviews, focus groups, and observations. Instead of counting variables, they look for themes or patterns in words, behaviors, or stories. Let's go back to the hourly rounding example that I mentioned earlier. A qualitative study might ask, how do nurses perceive the impact of hourly rounding on their workflow and on patient relationships? The answer to that question will not come in percentages. Instead, it comes in rich, descriptive narratives, quotes from nurses, patterns of meaning, and insight into the why behind behaviors or experiences. Qualitative research brings depth, nuance, and context. It does not try to generalize, it tries to understand. And in nursing, where we care for whole people, not just disease processes or symptoms, it is a crucial way of generating meaningful knowledge. All right, so what happens when your research question needs both a measurable outcome and a deeper understanding of experience? That's where mixed methods research comes in. Mixed methods combines the strengths of quantitative and qualitative research. You might start with a survey to gather measurable data and then follow up with interviews to understand the why behind the numbers. That's just one example. There are a host of different ways to structure and proceed with mixed method studies. So here's an example. You survey patients to see how many report satisfaction after they've received discharge teaching. That would be quantitative. And then you interview a small group to explore what made the teaching helpful or what possibly made it confusing. That would be the qualitative component. That's a mixed methods approach. This type of research is growing in popularity because healthcare questions are often complex. They're not just about numbers, they're not just about narratives. It's typically a blend of both. Now, before we move on, let's clear up a frequent source of confusion: the difference between method and methodology. This is especially important to parse through if you are in grad school and writing research proposals. So, methodology is the big picture blueprint. It's your research philosophy, it's your overall approach, such as quantitative, qualitative, or mixed methods. That's methodology. Methods are the tools that you use, like surveys, interviews, chart audits. So think of methodology as the why and the methods as the how. And understanding both of those helps you better analyze studies and recognize when the tools match the question. So by now, you might be wondering, okay, but how does this all help me as a practicing nurse? Here's the thing: you don't have to be a researcher to appreciate the type of research that you're reading. Understanding whether a study is quantitative, qualitative, or mixed methods helps you interpret findings appropriately. It also helps you know whether the results are generalizable or more context specific. And it also helps apply the insights in a way that actually makes sense for your unit or your patient population. Let's say you're part of a shared governance council that's reviewing evidence for improving shift handoff communication. If the article is quantitative, it might show that using bedside report reduces errors by, say, 30%. Great. But if the study is qualitative, it might reveal that nurses feel more connected to patients and to each other during bedside handoff, another important outcome. So, when you can identify the research type and you know what it's trying to tell you, you're better equipped to apply it in real world practice. Plus, if you ever get involved in a research or evidence based practice project, you'll know how to help select methods that match the question. And that's powerful. So, now let's bring all of this home. Today, we tackled the big differences between quantitative and qualitative research. We unpacked some underlying philosophical paradigms. We clarified the whole method versus methodology thing, and we gave a shout out to mixed methods research. So here's what you need to do after hearing this information. The next time you read a journal article or hear someone present findings, ask yourself, what type of research was this? What kind of question was the researcher trying to answer? And do the methods that they use make sense for the question that they asked? If you start noticing those patterns, you're going to be a stronger consumer of evidence and a better advocate for change in your practice setting. Also, reflect on this. Have you seen a research study misunderstood or misapplied because someone didn't recognize the type of research? Or maybe you've had one of those aha moments where understanding the research type helped you make better care decisions. And of course, stay tuned for our next episode where we're going to get a little bit more philosophical. Don't be scared. We're going to dive into the world of epistemology. If that just scared you, please don't be scared. We are going to go there. So don't worry, we're going to keep it fun and practical. Again, thanks for listening to Nursing Research Tips. Until next time, keep asking questions to grow your nursing practice.